data-driven as we move on. Thank you, sir.
Thank you very much, Senator Baldwin. Senator Collins.
Thank you, Mr. Chairman. Let me begin by first thanking each of our witnesses today for their expertise, their dedication, and their hard work. Dr. Redfield, I want to start with you. I am hearing from dentists all over the state of Maine that the fact that they cannot practice in our state, despite following very strict infection control protocols, is causing growing health problems. Dentists tell me that teeth with cavities that could have been filled are now going to need root canals. Teeth that could have been treated with root canals are now going to require extractions. People with oral cancers cannot get the treatment, the cleanings that they need before beginning their treatment. Dental health is clearly so important, and Maine state officials, as well as our dentists, are seeking assistance in reaching the right decisions. 47 other states either have reopened dental practices or have a date set for them to reopen. So my question to you is this: if dentists are following the American Dental Association guidelines, if they're instituting strict protective measures for their patients, their staffs, their hygienists, themselves, and if they're closely examining and seeing a decline in the number of COVID-19 infections in their county, are these reasonable factors for states to consider in reopening the practice of dentistry?
Yes, Senator, thank you for the question. We've been interacting and talking with dentists and working with the state and local public health officials to update our guidelines on reopening a variety of medical services, as you know. And I think you raise a very important point, and I would not disagree with what you said about looking at the American Dental Associations as well as the reality of the outbreak in the area. But we are in the process of updating those guidelines, and they will include direct guidelines for dental practices.
Thank you very much, Doctor. Dr. Giroir and Dr. Hahn, recently there's been a significant demand for remdesivir, I may be mispronouncing it, which transitioned to receiving an emergency use authorization. Last week, Maine's two largest hospital systems contacted me with questions about how this therapeutic will be allocated going forward. HHS finally released a statement on Saturday about allocations going to states, interestingly, not directly to hospitals. But once again, the decision-making behind these allocations is very unclear. HHS and the Assistant Secretary for Preparedness and Response say that each state is expected to receive an allocation, but no timetable has been provided. Beyond those who are being treated with this drug at Maine Medical Center through a clinical trial, I'm concerned that hospitalized patients in Maine will have little or no ability to be treated with this promising therapeutic for the foreseeable future. As this and more therapeutics and ultimately a vaccine come onto the marketplace, how can these allocation and distribution issues be resolved so that patient care is not delayed and so that it doesn't depend on which state you live in whether or not you're going to get access to these treatments and ultimately a vaccine?
Senator Collins, go ahead, Admiral Joa.
Go ahead. Go ahead, Commissioner.
Senator Collins, I think we completely agree with you that this has to be an evidence-based approach, getting the medical therapeutics, vaccines, remdesivir, whichever it happens to be, to the people in need. I think we can all agree upon the fact that we learned a lot of lessons from the remdesivir situation. And of course, as you mentioned, that's being led by HHS and ASPR. What you've seen in the most recent announcement is that what the task force did was provide guidance to HHS regarding where the most significant outbreak occurred and where those hospitalized patients were. This represented about a quarter of the supply of drug that we have, and more will be allocated according to the methodology that gets drug to where those hospitalized patients are. I think valuable lessons can be learned and will be learned with respect to other therapies and to vaccines in particular, and we must incorporate those into our operational plans moving forward.
Thank you, Doctor. Admiral, do you have anything to add? I'm over time, sorry. Thank you.